Good morning, everyone, and happy Tuesday. Today, in lieu of Valentine's Day, I wanted to talk a little bit about reproductive health. So, most of us know the human versions of the reproductive system, and they're virtually identical to the canine and feline systems. However, I did just want to go over the basics. The female reproductive system includes the mammary glands, the fallopian tubes, the ovaries, the uterus, and the cervix and the vulva. And in female dogs, obviously their opening is different than the males. In the males, this includes the prostate, the vas deferens, the testicles, the bulbous glands, the urethra, and the penis itself. For females, there are a few conditions that you can keep an eye out for, and I'll give a little bit for each gender. So they are kind of hard to diagnose, so without testing, especially internally, it's kind of hard to determine which your animal has, but if you're noticing any unusual behavior, then this could be what's going on. For females, follicular cysts are quite common. It basically means that the body's producing more estrogen, so their periods of heat are longer. Most periods of heat don't last that long, but if you notice that your female's heat is over 40 days long, it's very likely that they have follicular cysts. Pyometra is a little more common. It's a bacterial infection of the uterus that's especially common in unspayed females over the age of 5. So most people get their dog female spayed before they turn 2. So if your dog is over 5 and they haven't been spayed, it's basically a repetitive thickening of the lining of the uterus, because whenever they have heat, it builds another layer of lining, and that's what caused the cysts in the fluids. So because those layers keep building on each other instead of shedding, that the older ones kind of grow a little bit of bacteria, and it can be really, really dangerous for them. Vaginitis is another female condition. It sounds pretty much exactly like what it is. The suffix itis basically means inflammation. So arthritis is inflammation of the bone, or arthritis, bone and joints and tendons and things like that. Vaginitis is inflammation of the vaginitis. Inflammation of the vagina with either bacterial or viral, and in this case they'll urinate more frequently and it could be a strange color. So especially in the winter, it's easier to tell because they pee on snow most of the time, and it's easy to tell what color their pee is. If they're peeing on grass, it's definitely harder to tell, but take advantage when you can and make sure you're keeping an eye on their urinary output and the color of it, not just the quantity. Moving over to males. I always say this one wrong. Cryptorchidism is basically an undescended testes. So there is a genetic basis. However, if both of the testes don't descend, the dog will be sterile. It also increases the risk of testicular cancer if there is an undescended testicle. Oh gosh. Balanoposthitis is inflammation of the penis or the covering skin with a yellow-green discharge. So if there are any weird colored discharges coming out of any area of your dog, whether it be ear, nose, eyes, mouth, do get it looked at. Morning, Monica. Because that's not normal. Benign prostatic hyperplasia is enlargement of the prostate, which basically means the prostate's producing extra testosterone, which can have a lot of really serious effects on the body, especially in terms of bone growth, muscle growth, the development of the brain. And this one's especially common in unneutered dogs over the age of 6. So most people who do get their dogs neutered get them neutered before the age of 2. So if you have an older dog, just something to keep in mind. I have done quite a few videos about spaying and neutering and sterilization versus spaying and neutering. So if you want to learn more about that, there's plenty on my YouTube channel, so go check it out. Prostatic cysts. This one is kind of, you don't notice it until it's really, really bad. They're especially present when they grow large enough to pressure the surrounding organs, which basically is like a kind of like tumor growth. If your dog has an internal tumor and you don't notice it till it starts affecting the other organs nearby, then it's usually really late stage. This one requires surgical removal. So you know your dog, you know their behavior. If they start acting strange or not eating, or their heart rate changes, their respiratory rate changes, any secretions from their body change in frequency or color, then you know that something's going on. So do try and stay on top of it. However, most of this has to do with hygiene. Some of them are internal and there's not really much you can do about them, but females especially, they learn that responsibility of hygiene from their mom. So when they're a puppy, if they're taken away from their mom too soon, they don't learn those self-cleaning behaviors. So for example, after some females go to the bathroom, they will lick the area to make sure that it's clean and there's less chance of a bacterial infection. They also learn a lot of social skills from their mom and things like bite inhibition, play style, things like that. But if your dog has poor hygiene, that's something else you'll have to look at. If they were taken away from their parents too soon, they may not have those skills. So having them spend time with other dogs of their gender may be helpful, especially during that really important socialization phase, because they will still learn a little bit. They may not be as thorough with their personal hygiene as they could be, but it will come in handy. A lot of dogs, especially this time of year too, will lick their paws after to get the salt off so it doesn't irritate their pads. So just simple things like that. Keep an eye out. You know your pets. My audience is usually the pet parents that are usually really curious about how they can do more or help your animals more. So these are just a couple of tips for you. That's all I want to talk about for reproductive health. I know that one was kind of informationally dense, but I figured I haven't talked about reproductive health before. So never too late to talk about it, right? All right, I hope you have a fabulous rest of your week, and I will see you near the end of the week for another live video. I'm not sure what this one's about. I will check. Let's see. Ooh, a really good one on Saturday. I'm excited about this one because a lot of people aren't sure what they are, aren't sure the purpose of them in terms of interpreting body language, or just assume that the dog's being hyper aggressive. So I look forward to telling you more about this thing. And I will see you on Saturday on Instagram. Have a great morning, Monica. Bye.